Hello and welcome to Nurse Table Talk. I'm Nurse Julie. Have you ever heard of a condition called congestive heart failure, sometimes called CHF? And throughout the video, I'll be referring to it as CHF. Have any of your loved ones ever been diagnosed with it? About 6 million adults over the age of 20 in the United States have heart failure, and it is estimated that about 960,000 people will be diagnosed with it annually. The most common cause of heart failure is coronary heart disease. And CHF usually applies to a long-term condition, which it happens when your heart can't pump enough blood to circulate throughout your body. And then the blood and the fluids back up into your lungs and legs. It can be caused from structural or functional heart problems, such as atrial fibrillation, otherwise known as AFib, a history of a heart attack, a history of a pulmonary embolism, hypertension, otherwise known as high blood pressure, valve insufficiency, irregular heart rhythms. Other causes can be diabetes, obesity, anemia, infections, emotional stress. So what are the symptoms of CHF? Well, shortness with breathing, either with activity or when lying down, wheezing, a chronic cough, and sometimes that cough could have a frothy white or pink tinge to it, swelling in the legs and ankles, feet, that's pretty common, rapid or irregular heart rates, fatigue, weakness, loss of appetite, and even swelling in the abdomen. So what are the treatment recommendations? Well, medications play a role, and so does diet and activity as recommended by your physician. Daily monitoring of your weight and blood pressure is a great thing that's usually recommended before you eat. Keeping a record of your intake as fluids and your output is a good thing. That keeps your doctors aware. It should kind of balance out, keeps your doctors aware of what's going on. And of course, monitoring for your legs and ankles for edema. So you can always ask your doctor, hey, what do you want me to keep an eye on? And when do you want me to report things to you? It is usually recommended that if a person has a weight gain of 3 to 5 pounds within a week, they want to know about it. And things that they can, prescribe for CHF would be compression hose. Usually you get fitted for those. They may have given you a salt restriction of so many milligrams per day or a fluid restriction. Usually a low-fat diet is recommended sometimes a calorie restriction can be implemented as well. They may say, hey, you know what? You need to start walking a little bit and do other activity as you tolerate it. Sometimes oxygen is prescribed as well. Diuretics, vasodilators, supplements, maybe a potassium supplement may be recommended. But again, these are all based on your individual condition, what the causes might be related to, or is it advanced? How long has a person had it? So CHF can be managed. There's no cure for it, and the prognosis depends on the cause, and the treatment plan is the person trying to keep their condition from worsening. So all of that plays a role. So who treats congestive heart failure? Well, usually your primary care doctor will refer you to a cardiologist, and they're usually the ones that have the advanced experience with, these conditions. And a lot of times diagnostic tests such as echocardiograms, which is a cardiac ultrasound, may be performed. A CT might be recommended. A MRI, a heart cath if somebody has a blockage, or a PET scan. So some of those diagnostics can help the providers figure out what's going on. And sometimes surgical procedures, a heart valve replacement surgery or an ICD, coronary bypass surgery. These are just a few things, but every case is different. and your providers will work with you case by case and get you the best care and treatment that they can do. Can a person recover from congestive heart failure? Although there is no cure, it can be managed by the things that we mentioned earlier. And some of those treatment recommendations keep the condition from worsening. Prognosis depends on each individual and how advanced their CHF is or what the cause might be. A normal life can be led and CHF can be managed by you being proactive with your own health and following your medical provider's recommendations. Thank you for watching our video on Nurse Table Talk, and we look forward to seeing you again. Bye now.
Nurse Table Talk. Save time, save money, be informed. Thanks for watching.